Hey Kin 301ers, we are the regulators and we will be discussing L-carnitine as an ergogenic acid for patients with chronic obstructive pulmonary disease. Introduction to the topic. Patients with chronic obstructive pulmonary disease or COPD are intolerant to exercise mainly due to limited ventilatory capacity. This leads to deconditioning, early lactic acidosis, and reduced capillarity and muscle strength. An exercise training program is the main component of pulmonary rehabilitation for COPD patients, increasing exercise capacity and reducing dyspnea. Therefore, exercise training can result in beneficial changes in exercise capacity and has been shown to consistently improve the quality of life of COPD patients. In addition to exercise, nutritional factors such as L-carnitine supplementation have been used to improve physical performance. L-carnitine is a quaternary amine whose function has been related to lipid metabolism, sparing muscle glycogen, improving tolerance to physical activity, and reducing muscle fatigue. It has also been demonstrated in skeletal and cardiac muscle, in plasma, kidney, liver, and brain. The effects of adding L-carnitine to a whole body and respiratory training program were determined in moderate to severe chronic obstructive pulmonary disease or COPD patients.
Research included 16 chronic obstructive pulmonary disease patients selected between ages 66 plus or minus 7 years. They are randomly assigned to L-carnitine or placebo group where they received either L-carnitine or a saline solution 2 grams daily orally for 6 weeks. Both groups participated in three weekly 30-minute treadmill and threshold inspiratory muscle training sessions with 3 sets of 10 loaded inspirations at 40% maximal inspiratory pressure. Nutritional status, exercise tolerance on a treadmill and 6-minute walking test, blood lactate, heart rate, blood pressure, and respiratory muscle strength were determined as baseline on day 42.
Important findings of the research. Maximal capacity in the incremental exercise test was significantly improved in both groups. Blood lactate, blood pressure, oxygen saturation, and heart rate at identical exercise levels were lower in control group after training. Inspiratory muscle strength and walking test tolerance were significantly improved in both groups, but the gains of control group were significantly higher than those of placebo group. Blood lactate concentration was significantly lower in control group than in placebo group.
Take-home points for our article include: L-carnitine may be beneficial in reducing lactate production as well as improving exercise tolerance and inspiratory muscle strength in patients with chronic obstructive pulmonary disease. However, this supplementation was not associated with modification of the degree of airflow obstruction, improvement of nutritional status, or an increase in muscle mass. Future research intended to support these findings should aim to have a study that has a larger sample size as well as a study that is double-blinded.